As everyone already knows, these attacks are not incidental, they are deliberate. By targeting energy generation and distribution, Russia is undermining the very foundation of civilian life. Today, Ukraine's health system is operating under extreme and sustained pressure. Since the beginning of the full-scale invasion, more than 2,900 attacks on healthcare have been verified. Over 230 health workers and patients have been killed, around 1,000 injured, and more than 2,300 health facilities damaged or destroyed. At the same time, over half of Ukraine's electricity generation capacity has been lost, leading to severe power shortages, especially during the winter of 2025-2026, very harsh winter, when millions of civilians were left with only a few hours of electricity per day. This is the reality in which doctors and patients must function. Hospitals are forced to rely on unstable power supply, ration electricity, and make impossible decisions. Critical services, including emergency surgery, intensive care, maternal and neonatal services, are directly affected. Facilities in frontline and affected regions, where up to 17% of health infrastructure has sustained structural damage, are particularly vulnerable. This is not an abstract crisis. It affects more than 3.3 million internally displaced people across Ukraine. It affects communities where access to healthcare is already constrained, where only a fraction of those in need are able to receive timely services. It affects a population where 50% report their health has worsened over the past year. The most vulnerable, older persons, patients with chronic diseases, persons with disabilities bear a disproportionate burden. And again, even today, we see this reality unfold. The massive strike on Ukraine that lasted from the evening of March 23rd to the evening of March 24th became the largest strike drone attack since the beginning of the full-scale war. Russians used almost 1,000 UAVs, and in addition to that, cruise and guided aviation missiles. To give you an example related to our discussion today, a Russian drone strike on 24th March hit the center of Ivano-Frankivsk, killing 2 people and damaging both the city and regional maternity hospitals, facilities that should be places of safety and hope. This has clear implications under international law. The systematic targeting of civilian infrastructure, combined with its predictable and severe impact on healthcare, must not be treated as a byproduct of war. These acts may constitute serious violations of international humanitarian law and in certain cases amount to war crimes or crimes against humanity. At the same time, we must address an important gap. Much of the indirect health harm remains insufficiently documented. Patients who cannot access dialysis, those whose treatment is interrupted, those whose conditions deteriorate during power outages, their suffering often remains invisible in traditional assessments. This is why today's discussion is so important. It helps connect evidence from the ground with legal accountability. It highlights the real human cost behind infrastructure attacks, and it strengthens our collective responsibility to act. Ukraine deeply appreciates the support of international partners, including the World Health Organization and humanitarian actors who continue to sustain healthcare delivery under extremely difficult conditions. But humanitarian assistance assistance alone is not enough. We need stronger international action to ensure accountability, to document these patterns of harm and to prevent further attacks, because silence and inaction allow these violations to continue. Thank you very much.
Thank you very much, sir. This is a perfect framing for our panel. And in fact, I would like now to give the floor remotely to a doctor who joins us directly from one of the hospitals that was hit by Russian strikes back in July of 2024. I don't know if we can have her on the screen on WebEx. Uliana Poltavets.
Я думаю, мова йде про Лесю.
Apologies, yes. No, we... Leza? Yes.
Yes.
Leza, very good. Leza, from the hospital in Kiev, from the pediatric hospital in Kiev. You have the floor. If you want to introduce yourself a little better than I did, that would be great.
Okay, right. So good afternoon to everybody. Dear ladies and gentlemen, dear all, I'm Dr. Lesa Lisitsa, actually ophthalmic surgeon and ocular oncologist at the National Children's Specialized Hospital Ahmedit in Kiev, Ukraine, the largest pediatric hospital in the country and the National Referral Center for Children with Complex and Life-Threatening Disease. I am speaking today not only as a physician, but as a doctor who has to treat children during blackouts, make surgical decisions without stable electricity, and recognize care while missile attacks target the energy and infrastructure and hospital itself that keeps hospital functioning. For many healthcare systems, electricity is infrastructure. For us, electricity is survival. Since 2022, attacks on Ukraine energy infrastructure have fundamentally changed how healthcare is delivered across the country. Hospitals have been forced to adapt quickly, not to medical innovation, but to power outage. When electricity is disrupted, hospitals face immediately optional challenges. First of all, operating room cannot function normally. Ventilators require backup power. Imaging equipment shut down. Electronic medical records become inaccessible. Sterilization systems are interrupted. In pediatric oncology, ophthalmic oncology, and critical care, these disruptions are not minor inconvenience. They directly affect patient survival. At Ahmedit, we treated patients with a cancer, rare disease, and complex conditions from across Ukraine. Many of these children depend on timely diagnostic, repeated anesthesia procedure, and multidisciplinary care. But during power outage, we had to do cancel surgery, postpone chemotherapy procedure, delay imaging, reschedule anesthesia-dependent examination, reduce hospital capacity. These decisions are painful because delays in pediatric oncology can change outcomes. Cancer doesn't wait for electricity. This disruption affects the most vulnerable population, children, critically ill patients, and those require continuous care. According to the World Health Organization, attacks on energy infrastructure in Ukraine have rapidly disrupted essential healthcare service and affected millions of patients depend on electricity support care. Patients who require dialysis, respiratory support, intensive care, especially blood marrow transplantation, cancer treatment, and particularly vulnerable during a power outage. Each of these things increase risk, and we see this in clinical practice. Patients arriving later, decision progression, more complex surgical cases, reduced changing for organ-preserving treatment. These are not theoretical risks. These are clinical reality, our duty now. In 2023, large-scale attack on Kyiv energy infrastructure created prolonged blackout that directly threatened patient hospital operation. We need to cancel several big surgery. We provide blood marrow transplantation on the generators. At Mahmadid, we are forced to switch the energy protocol. Operating room moved to generator power. Department reorganized patient flow. Elective procedure postponed. Staff rebuilt the maintained critical service. There were not short disruptions. Some lasted hours, some lasted longer, and every hour without stable electricity increased risk for the patients, especially in pediatric hospital, especially when patient requires anesthesia, especially when time matters. Generators became our lifeline. They allowed hospital to continue functioning during outage. But generators are a complex solution. Generators requires fuel. Fuel requires storage. Storage creates safety risk. Supply chains and vulnerable during attack. Where do we store fuel? Saved near at the children's hospital. How do refuel during the air rapid alert? How do ensure supply when infrastructure is damaged? There are questions the health professional now face regularly. Hospitals have had to become not only medical institution, but also energy manager. There is another important mission that is often overlooked. While the global medical community continues to advance, developing new technology, conducting research, implement innovation treatment, Ukrainian healthcare professionals are forced to focus on survival. While others invest time in research, clinical trials, and scientific progress, we invest time in continued planning, emergency logistics, and crisis response. We are not only doctors, we are also infrastructure manager, logistic coordinator, crisis responder. We are working overtime not only to improve care, but to preserve the healthcare system itself. We adapted continuously. At the same time, we are still introducing new treatment approach, modern surgical technology, and multidisciplinary care model despite the condition. This creates a double burden. We are expected to maintain standards of care, implement innovation, conduct research, train staff, and at the same time, survival blackouts, manage fuel, reorganize department, support exhausted teams. This is not sustainable. And yet Ukrainians has work continue to do both. We are not only preserving healthcare, we are trying to move it forward under extraordinary conditions. Beyond infrastructure, there's another crisis, healthcare working exhausting. Doctors in Ukraine work during sirens, blackout, disruption, during the absence possibility go home, burn out, injure doctors and system at all. It leads to staff shortness, reduced capacity, delayed service, increased risk of error. Healthcare workers continue because patients continue to arrive. Children still need surgery, cancer still requires treatment. Power gauge also affects across to care. When electricity fails, transport systems are disrupted, connection system fail, referral networks slow down, electronic records become inaccessible. Patients from regions under attack often arrive late. Some travel for days, some miss early diagnosis, some are attacked during their way to hospital. In oncology, the lies worsen outcomes. We are not abstract consequences. They are human stories. Children arrive with advanced disease, families traveling for long distance, doctors trying to compensate for lost time. There's also a psychology tool. Patients experience anxiety, parents fear treatment delays, health workers experience chronic stress and burnout. Mental health supports still stay limited. There's another invisible consequences of attacks on infrastructure. Attacks on the energy infrastructure are not only attacks on electricity, they are attacks on healthcare system, patients, human rights, the right to health. Systemic attacks on civilian infrastructure created measurable health consequences and disparately affect vulnerable population. Healthcare should never depend on whatever electricity survives the night. While the word advanced medicine, Ukrainian is fighting to keep medicine alive. Even in this condition, we continue to innovate, adapt, and care. But we want to say once again, healthcare should not depend on generators. Doctors should not depend on supply. Patients should not depend on power grids. And yet it's happening every day in Ukraine. Despite this, Ukrainian health workers continue to provide care in dark, under pressure, with determination, because stopping is not an option. Thanks a lot.
Thank you, Doctor. If you stay with us on the line, if possible, we might come back to you during the Q&A in case there are questions from the floor. Thank you very much. It's now my pleasure to give the floor to our friends and colleague from Hounds. Hounds is one of the most active and professional human rights organizations operating in Ukraine, and has documented violations of international law committed during the conflict from the very first day. And one of the many reports has focused precisely on the topic of this session, and they are also the co-sponsors of this event. So I'm very pleased to be able to give the floor to Evan Harari, who is one of the researchers that has worked precisely on this topic. Evan, you have the floor.
Thank you very much, Nicolo, and thank you for all those present for attending this event and for listening us speak on this very important topic. So since my colleagues have given a full and very pointed picture of the damage in terms of data, in terms of the daily practice of health, I'd like to give sort of a synthesized picture of what this actually means in the broader context of attacks on civilians in Ukraine, as well as what the particularized harms to what we call sentinel populations. So these are vulnerable people, the elderly, those with chronic illnesses, those with rare and severe illnesses, those on dialysis, what these consistent outages mean to people trying to just maintain their health and live their daily lives in their homes. So let's start again with where we are. This is the fourth consecutive winter of attacks on energy infrastructure. And the harm doesn't stop with each winter, with each season. The harm accumulates and interacts to produce more severe and more cascading harm. So if we're thinking about these patients, if we're thinking about these healthcare workers, the harm is not isolated to the hospital. We're talking about experiences of heating outages, of electricity outages for many hours a day in negative 20 degrees Celsius. We're talking about water distribution ceasing to work, electricity rationing, elevators that don't work. There are cities where buses may run on electricity. So for people whose mobility is limited, they may not be able to leave their region. They may not be able to cross the river to get to the other side of the city. And if we're talking again about the broader context, there may be regular aerial attacks in frontline cities, the threat of drones, of shelling, of relatives who are on the front line, of relatives who have been detained, who are still detained in infiltration. So this is the broader context of what we're talking about. And we're talking about health outcomes. We're talking about mental harms. This is another factor we have to consider when we talk about attacks on energy infrastructure. So as my colleague mentioned, Hounds and Physicians for Human Rights, who we're here for just after me, we work together to document the harms specifically to healthcare from attacks on energy infrastructure. So these are both direct and reverberating harms. Direct harms is, of course, the harm that is one causative a step away from attack on energy infrastructure. So if an attack cuts out power in a hospital, procedures are interrupted, dialysis machines go offline, that's an immediate harm. It's a direct harm. What we want to look further at is the reverberating harm. What happens when patients can't get regular diagnoses, when medication is missed, when appointments are missed because elevators don't run? This is the harm we want to look at so that we can get a full picture of the true suffering that patients may go through in Ukraine. and then translate that to an accountability lens. So working in 2024, we found that 2/3 of workers reported that energy actors directly affected medical procedures. So there's direct harms, including delayed surgeries, failure of life support systems, disruptions to intensive care, diagnostic equipment, oxygen supply, and emergency services. These are, of course, predictable and foreseeable results of attack. We may even say that this is the point of attack, right? If someone is planning an attack, they're going to understand that knocking out the power infrastructure in a modern integrated society is going to have a very severe effect on the operation of health. Going beyond that direct attack, in this November, we sought to assess more directly what are the reverberating harms on vulnerable populations. So we looked at those in need of dialysis, those with chronic and rare illnesses, the elderly and mobility restricted, and those who are suffering from cancer. And we found, again, predictably, foreseeably, that power outages lead to a breakdown of essential living conditions that directly threaten life and well-being. So let's look at this practically. An attack for someone who is in need of constant dialysis, the machine turns off, they have a needle in their arm, they're exposed, they're undergoing treatment. This is obviously going to cause a severe deterioration in their physical and mental health. Physical health, we understand why, but mental health, think about it. We understand this person needs to survive. They don't know when power is going to come back on. And they don't know if anyone can come to help because, again, we're looking at the full picture. Power attacks interrupt emergency services. They disrupt emergency services' ability to maintain special protocols for populations in need. So there's that added anxiety of knowing you're not getting the treatment you needed and not knowing when you're going to get the help you need. With water shortages, we found with water shortages, patients in particular need of sterile conditions constantly in their home because they're at increased risk of infection. In these conditions, they find it very difficult to maintain hygiene. And this leads to increased risk of infection, increased risk of comorbid conditions and diseases, but also, again, constant decreases in mental health. We found that these harms are both acute, so you have these sort of acute instances of power outages, of prolonged outages in heat and electricity leading to deterioration of health, but they're also syndemic, so they're cascading and deepening. So what we did is looking across all these data indicators, we sought to construct cases of what it actually looks like for someone who is elderly, for someone who is undergoing dialysis perhaps, to live through a winter of power shortages. We looked at people who may live alone. They may not be able to leave their apartment consistently because they depend on an elevator. They can't walk down the stairs. Their access to telehealth is disrupted. They can't talk to their doctor because Wi-Fi doesn't work, because power is consistently out. And when power is on, we just heard from a healthcare provider, doctors are just looking to adapt and survive and are sometimes not able to reach patients who are not in their facilities. This means that appointments may be missed, symptoms may be missed, treatment may be missed, and challenges to hygiene may again undermine treatment or diagnoses. As I said, this is something that decreases health outcomes and increases the burden of mental health conditions. This is something, looking at the data, we understand this is what is sort of common sense, and which is clearly going to be foreseeable in the minds of military planners, that consistent, persistent attacks on energy, heating infrastructure that knock out up to 60% of generation capacity in Ukraine are going to have extreme deleterious effects on the health, physical and mental health of populations, and in particular of vulnerable populations. As my colleague, the ambassador, mentioned at the start, this is actually only a fraction of the picture because data collection is inconsistent, and looking at reverberating harm is not consistent across region, is not tracked in the same manner, data sets are incomplete. So our ability to understand this is somewhat limited based on current data collection methods, but even if with what we have, we understand that this harm is severe, growing, foreseeable. So to conclude, I'd like to get back to the point of the broader picture. What is actually happening in Ukraine? This is a full-scale invasion and an attack on civilian life from every aspect. These attacks on energy infrastructure are part of that broader attack on civilian infrastructure. The suffering to sentinel populations, to healthcare providers, the very predictable, inevitable consequences to the healthcare system in Ukraine. This is the point, and not an incidental consequence of attacks on energy infrastructure. It is not lawful to degrade a society's medical infrastructure in an attempt to degrade morale, drive migration, or undermine economic or long-term national viability. But this is what we see is the goal of attacks on energy infrastructure. With that context understood, we must take action to assess these attacks as a matter of international humanitarian and international criminal law. We must assess whether these attacks violate the prohibition on attacking civilian objects, on attacking objects indispensable to the survival of the civilian population, whether they violate the principle of proportionality or may constitute the crime of launching an attack that causes excessive harm to civilians under the Rome Statute, or whether these attacks may constitute the crimes against humanity under Article 7 of the Rome Statute. Thank you very much for your time, and I look forward to hearing my colleagues further on this subject.
Thank you very much, Evan. We'll probably come back to you to go a little deeper on accountability and on the law, since you mentioned it only very briefly. But first, I want to give the floor to Uliana Pultavets from Physicians for Human Rights. They have also engaged in extensive research on the impact on the health sector in Ukraine, and in particular, here we go, Uliana, on the impact on hospitals and doctors. Uliana, if you turn on your mic, there you go. You have the floor, Uliana.
Thank you so much, and thank you to all organizers and co-sponsors for bringing us together for this discussion. So a lot has been already said, and I don't want to repeat myself, so I'll try to be brief. But just to underline, as everybody here already said, that attacks on health should be understood in Ukraine as part of a broader campaign of assault on civilians, and particularly when healthcare is attacked, the harm goes beyond a single hospital or an ambulance, because it affects the whole community. When a hospital is attacked, communities are no longer survivable, and this is actually what drives people to leave their communities and even the country. And this is what we at Physicians for Human Rights and our partners like Truth Hounds have documented in Ukraine. Just to place in a context, we've been documenting attacks on health since the start of the full-scale invasion with Truth Hounds and Security Inside Ukraine Healthcare Center, Eyewitness to Atrocities, Media Initiative for Human Rights, and we have documented over 2,500 attacks on health. And in 2025 alone, incidents rose by almost 50%. So this means that the attacks have not only not stopped, but also escalated. And it's a sustained and evolving pattern of harm directed at the people, facilities, transport, and infrastructure that is required to deliver care. So the scale is already staggering, but it's also the patterns that are important. The patterns also evolved. Early in the full-scale invasion, most incidents involved artillery, rockets, and other ground-launched weapons, but most recently, the expanded use of drones has transformed the threat landscape. We've documented an increase in the use of drone to track healthcare from 25 incidents in 2023 to over 300 last year. So that's a 1,000% increase. And of course, that disrupted medical evacuations, emergency response, and healthcare delivery. But in the rest, all over the country, the pattern increasingly includes attacks on systems that make care possible, like electricity, and this is what we're focusing on today. And these attacks are not just attacks on energy, but they're also attacks on conditions under which civilians live, access care, and sustain community life. So Evan has noted that we surveyed over 2,000 healthcare workers in all regions of Ukraine. I also wanted to note that there were also reported permanent health harms and death linked to these disruptions when we did that survey. We spoke to one of the hospitals that was first occupied in Mariupol and became a military base there. And then the staff and the equipment was relocated to Kiev. And then in Kiev, it was again attacked through attacks on energy, because in the hospital during the first wave of attacks, the generator was broken and it was not working. And because there was no water in the hospital, only one bathroom was working. So it really shows how one hospital can have multiple layers of impacts. I think it is also important to know what Dr. Lisitsa was talking about the stress and the burnout that results from these attacks. Our survey showed that over 80% of healthcare workers reported stress and burnout resulting from these attacks, as a lot of the adaptation becomes another burden for the staff. And this is what Dr. Lisitsa was talking about. Ukraine has already lost over 20% of its healthcare workforce since the beginning of full-scale invasion, and the attacks on energy just add to the strain that is put on healthcare workers, an already stretched workforce. And the adaptation tools that are put in place are also not always reliable. Generators break, as we heard from the hospital, require a lot of fuel, create environmental risks. The noise that they produce is triggering for many times of war. It also means that modern equipment and protocols might need to be replaced by older ones that don't require electricity, and thus the quality is also degraded. Evan also noted how in our last research, we focused on impacts outside of clinical settings. And of course, what we found that the harms that people experience at home are layered and compounding, and they're not experienced one at a time, they overlap. If you need a machine to ensure your survival, you are tied to power cut schedule. You cannot cook food because of electricity, because of the power cut. You cannot keep warm because there's a heating outage. You cannot leave your apartment because there is no elevator working, and you cannot seek care. And all of that results in an increased vulnerability and risks. So for example, we had one dialysis patient who had to organize her whole life, her whole schedule around the power cut schedule, because she was doing dialysis at home, and her entirely daily life had to be organized around that power cut, and the fear that the next outage may interrupt a life-sustaining treatment. Several people with disabilities that we spoke to struggled with severe muscle pain due to spasticity resulting from cold temperatures at home. And we also know that some of the cancer medicines that are very expensive were not stored safely because of the disruption of the cold chain due to absence of electricity. It was really hard for people to get to treatment because transportation is often not working. So it also adds to that increased stress. We also reviewed some of the data from the National Health Service and selected regional medical data to examine whether there are temporal alignments between intensified attacks on energy infrastructure and disruption in health service delivery. And it is very difficult to assess causation and attribute specific health outcomes to individual attacks, but it is still useful to identify notable patterns that, in our opinion, warrant further investigation from relevant mechanisms. So this include a marked decline in planned hospitalizations across multiple disease categories between October and December 2022. So this was during the first wave of attacks on energy. Increases in emergency pressure in some regions, increase in premature birth following the waves of attacks, changes in decision-making patterns of dialysis patients following the first wave of attacks, when patients increasingly switched to at-home dialysis and could not access services in the hospital, and disruptions to continuity-sensitive services such as oncology care during the first and second wave of attacks. Of course, all of these harms intensify in winter, particularly in cities such as Kiev that were experiencing some of the coldest conditions this year in over a decade. And we're yet to see the full impact of attacks that happened this winter. So the health consequences of these attacks pose very serious questions under international law, as Evan might outline a little bit more. And the question is whether accountability processes are prepared to capture the full harm, including the downstream harm, as a lot of it is not documented by classic documentation mechanisms, but in reality, they affect many people. If a hospital is attacked, if there's a missile attack on a hospital, there might be immediate casualties, but if we count all of the vulnerable populations that are affected by a power cut, that are no longer able to access care, that covers hundreds of thousands, if not millions of people. So all of that has to be included into military decision analysis, into accountability processes. So we strongly believe that attacks on energy in Ukraine are attacks on health. They're attacks on the systems that keep people healthy and alive and make normal life possible. And we strongly urge everyone in the room to support any kind of accountability for this type of attacks, and to include the full scope of harms that occur following these attacks. Thank you, and open for questions.
Thank you very much. Thank you for your testimony, Juliana. We'll now, I think, go for a quick round of questions. I might start, if you don't mind, and then we might take some questions also from the floor. But just to get the discussion going, we've witnessed in Ukraine deliberate attacks against first responders. This is one of the patterns. Sometimes they call it a double tap attack. You bombard somewhere, and then you wait for the ambulance people and the firemen and to arrive, to respond to the victims, and then that's where you strike again in order to diminish the capacity of society to respond to save lives. And basically, you increase, you multiply the impact of the first attack by destroying the capacity of the community to mitigate the impact of that first attack for the long run. Now, this is a direct attack on the healthcare capacity, or the capacity of the state and of society to respond to the obvious direct, immediate health needs of those who are trapped on the rubble or who have been targeted by drones or missiles. Now, that's easy to say, that it's a deliberate attack, not only on the civil population, but also on the capacity to respond. How do you examine the intention behind the attacks when the consequence of power outages is on hospitals, but the hospitals are not the direct targets of those attacks? Now, hospitals have been also direct targets, and I think what Lesia did not mention is that she's a pediatrician in a hospital, in a children's hospital, was actually the direct target of an attack in July of last year, the year before. And that's in a way easier. But my question is, how do you assign responsibility and how do you reconstruct decision-making when there is a direct result which is visible and measurable, but when it is a result of an attack on something else, not on the hospital? And that's a question a little bit for all of you, and it's the first question that I'd like, whether it's whether it's Evan to address it or another one of the panelists. And then I wanted to ask Leslie in particular, you gave us a flavor of what it means when the lights go out, the generators kick in. And obviously patients in dialysis with a needle in their arm are not going to be coming for dialysis as willingly next time when the lights go out. And the same will be for cancer patients who are undergoing treatment. And the same, of course, will be for everybody who needs access to healthcare. This paints a very, very clear picture in our minds. But I wanted to ask you if you want to tell us of any specific cases that you've witnessed or your colleagues have witnessed that illustrate this. And if this, in a way, you're on the ground, you're intervening here in Geneva, but you're on the ground. If there's any stories that you would like to tell us, which I think that you think are illustrative and can give us an even more concrete example of what we're talking about, and what the implications are in terms of your capacity to provide medical care, which ultimately is what you do as a doctor. First round maybe of questions, and then if you can be brief, I would also like to open to wider to those in the room. Evan, you go ahead.
Yes,
If I talk,
unfortunately,
the double tap effect is something we've observed, and we've issued a report on titled Cruelty Cascade, and I encourage you to look at the results of that, because we have, particularly in frontline settlements, documented a repeated pattern of targeting first responders when they arrive, and we've seen, talking about trends, increasing use of FPV drones to target first responders. And it becomes a form of intimidation and of terror, because FPV drones are obviously readily operated in the moment, and we see operators actually hovering over the sites of previous strikes, almost as a warning to first responders not to approach, or they'll suffer a double tap, and at times a triple tap attack is what we've documented. In terms of accounting for the broader effects of that, we construe this as part of what it is, which is a form of terror. So this is something that's meant to chill, not just prevent the damage, the rendering of aid, but meant to prevent responders from actually addressing and doing their jobs. And it's something that drives civilians into their home and actually drives civilians away from their settlements when they realize that they may get hit and there may be no help coming. So that's sort of how we account for that. And in terms of sort of accounting for the broader chain, when effects aren't necessarily direct, I think it comes down to not necessarily artificially truncating the legal standard when it comes to what is foreseeable and what is predictable. What is understood as foreseeable has to change with time. The first strike, there may be some plausible argument that a reasonable military commander didn't know that this would affect vulnerable populations, didn't know that would cut power off from a hospital. But when we're talking about the second strike, the third strike, or the fourth consecutive winter of hundreds of strike, there's really no common sense explanation for not taking this into account, because a reasonable commander has access to the news, has access to detailed reporting, has access to information that's right in front of them. And so this is just reasonably foreseeable. So it's sort of built into the standard.
Thank you.
Okay.
Doctor, I don't know if you want to add something.
Yeah, what I want to add, it's always very painful decision. So I was that doctor who take decision to stop operation during missile attack, because the sirens started and air alert started actually after operating day previously had started. And we need to interrupt our surgery because of the hospital attack. My husband, who's also head of BMT department, interrupt blood marrow transplantation and need to relocate all his department with whole patients and staff to another hospital on the left side of the Dnipro of the Kiev. So you never can be prepared to make this decision. But during living last 4 years, we need to be ready to change our plan every day. So unfortunately, it's become normal to us stop surgery on some moment and move with the patient in another hospital. And it's a big risk of infection for the patients. And unfortunately, we can count how many patients died during missile attack. We can count how many hospital was attacked, but we cannot count how many patients died because they was infected during transportation. How many patients died because of infection or because of delaying of the treatment. It's unfortunately impossible to calculate.
Thank you. Thank you, doctor, for that testimony. Uliana, is there anything you'd like to add on this?
Yes, just briefly, we also talked to a healthcare worker from a maternity hospital in Zaporizhia, and she told us that this is just an example, another example of how the effects are on the hospital and on procedures. She told us that surgeries, and these are deliveries, birth, surgeries had to be performed with flashlights in cramped conditions, which meant that instead of a conventional hour, it took about 3 hours to complete the surgery. The quality of sutures was lower, so it really affects the patient, as Dr. Lesa also said, but it also affects healthcare workers in the way that they have to plan. So it almost becomes a triage, a medical triage of what you can get to under the circumstances, and also what can be covered by power generator. You cover the intensive care unit, but you don't cover something else because the low power generator cannot cover everything. And just another thought on the drones, continuing what Evan said, we also have testimonies from healthcare workers who are now removing the Red Cross symbol from their cars because they're afraid to be targeted, because there's a hunting game that is currently going on, literally hunting cars, and particularly medical evacuations and emergency cars. That has become popular, unfortunately, among Russian forces, and they openly post about it on their social media. So I just think that it's this normalization of breaking the law is just very scary.
May I also add a little bit, but not as a doctor. I want to add like a woman who delivered a baby during a huge missile attack on Kiev. So I remember this night in the maternity house, in the shelter, like my personal hell, and only what I'm praying of to give a birth in the morning when there was no missiles in the air, at least a drone. Because when you're a doctor, you can make a decision. But when you're a patient, you cannot make any decision. And especially when it's unpredictable situation like give a birth. Thank you.
Thank you, doctor. We have just a few minutes for questions from the floor. So, the representative of France.
Thank you so much. Well, first of all, thank you for organizing this side event, and especially for sharing those experiences from the ground, from NGOs and from healthcare workers. of course, we're very admirative of their work, their resilience in these conditions. Well, France has provided, as other countries, strong cooperation for the last 4 years to their work, and will, of course, continue to do so. We also support the accountability processes for this kind of attacks, and I have a quite simple and as well quite complicated, I guess, question. Do you think it would be possible to quantify at some point the number of casualties due to the consequences of those attacks to the on the energy infrastructure for the healthcare system?
Thank you, sir. We'll take one, two more questions. Sarah? Introduce yourself.
Thanks. Okay. Tara O'Grady, I'm a human rights defender from Ireland. I just want to say really quickly that this is chilling to me, considering what the current state of the world is and how people have become so desensitized. And I think that's an aim of the media. I really want to applaud the work of all of the medics who are so versatile and managing to continue to provide healthcare despite this constantly shifting situation. I want to ask, with regards to your recommendations for what we should be focusing on to try to change the dynamic, what we should be prioritizing to keep momentum and pressure from the outside. And the numbers are absolutely shocking to think that 2,300 healthcare facilities have been destroyed or very badly disabled. And it's very sobering. So I'm really keen to hear from you, your recommendations. And I also want to ask the second part to that question, if you could give us some insight into what's happening at the Izolatia Cultural Centre with the rising number of torture cases, people who have been disappeared, and sexualized violence. Thank you.
Thank you very much. Unless I have any other interventions, I'll ask the panelists to be very, very brief. We have to leave the room in about 120 seconds, but I'm sure those will be, you'll be able to. Yes, go for it.
I can try to reply to the first question very briefly. So it's very, very hard to establish any kind of causation for attacks on energy to attacks on health. These reverberating impacts are less visible than the strike itself. But as Evan said, in protracted conflicts, they're not difficult to foresee. There have been reports, so it's foreseeable for a reasonable commander to know that this would happen. And while we are not always able to kind of see this causation numerically, it's the case studies that are most important to document this harm. So it's important to document the numbers, but alongside each number, we need to provide a context, and this is what we're trying to do right now. So in the coming years, I think we'll have more of that documentation coming your way.
Thank you. I might conclude by thanking the panelists and thanking the Permanent Mission of Ukraine and all co-sponsors for joining us in this side event. It's clear, I think, that the deliberate and systematic targeting of energy infrastructure that is serving the civilian population has the result, and after repeated winters, the evident objective of punishing the civilian population. And I think it's also clear that accountability for those crimes is both needed and coming. And that is what I would like to leave you with thanks for all who has attended, both in person and online. Thank you.
Okay. Я подолала свій два великі страхи, зробила навіть те, що не планувала, тому...
You can drop your connection, please. Thank you.
Сейчас я звук виключу.